I'm Dr. Hasanain Kahtan. Today the lecture is entitled Complication of Complete Denture, Post-Insertion Problems. Introduction. Fabrication of complete denture is based on psychological interaction between the patient and the dentist, where healthy communication acts a significant role in success of treatment of completely edentulous people. Several post-insertion problems may occur because of wearing of new complete dentures. Causes of these problems may relate to failure of the dentist to prepare and educate the patient about the new experience, or failure of the patient to adapt to the prosthesis, or even to faults in the construction. Generally, many problems have been reported which can be randomly enumerated as following: looseness or instability. Lower denture rises when mouth is opened. Sore spots. Gagging. Feeling of space in upper denture. Phonetic problems. Can't eat most foods. Masticatory insufficiency. Loss of taste. Clicking while eating or talking. Tenderness when swallowing. Food under dentures. Saliva under dentures. Dislodgement when drinking. Drooling at corners of mouth. Excessive bulk. Cheek, lip, or tongue biting. Halitosis. Dry mouth. Excessive salivation. Unusual tastes. Temporomandibular joint problems. Burning sensation. Pain and discomfort. The most common complaints reported include: number 1, pain or discomfort, looseness of one or both dentures, speech problems, chewing problems. Pain or discomfort. This picture shows the adaptation of pressure indicating paste to disclose the overextended peripheries. Free space problems. Reduced freeway space problem may lead to pain or discomfort. Pain on crest of the alveolar ridge. This is because of the reduced or the poor quality of the ridge, where the pressure will be applied on the bone. Looseness of one or both dentures. When the patient complains of looseness, you need to check peripheral extensions, posterior palatal seal, adaptation of the bases, occlusion, shape of the polished surface, tooth position. Loose dentures. Failure to obtain a peripheral seal and poor adaptation of the denture to underlying tissues. This should be suspected if the patient complains that food accumulates beneath the denture. Denture drops occasionally. This may be due to a low frenal attachment, and providing more relief for the frenum may help. The bulky width of the polished surface around the maxillary tuberosities where the denture can be displaced by the coronoid process during mouth opening. The occlusion. Check the occlusion, eccentric relation, and excursive movements. If there is locking of cusps when undertaking excursive movements, then the dentures can be displaced. If this has been reduced too much, then speech is often affected. The thickness of the palatal acrylic. If this is bulky, then the problem may be resolved with reduction of the bulk. Chewing problems. They are presented as either an unsatisfactory chewing function or as biting of cheeks or lips when chewing food. The teeth are too flat. Or insufficient freeway space. Or excessive freeway space.